let's talk just state of the union, state of of teen health. Um, it's 2023. It's May. Uh, let's start with Dr. Gold. Compared to, I don't know, 2, 3 years ago, early in the pandemic, where are we?
I don't feel like it's ever really stopped. I mean, I think that when the way I think about mental health for all groups, but including the group that I fit in here with, which would be college students, is that like our mental health, their mental health wasn't great. And then COVID came and made it worse. It's not like a COVID fairy came down from the clouds and was like, now you have bad mental health. It was like bad before, it's worse now. And whatever the stressors are might change, right? Like, so at the beginning of the pandemic for college students, being at home and not with their friends was a stressor. But now maybe being back and reintegrating to having to be around people all the time is a stressor. So the stressors can change, but their mental health is still bad.
Yeah, I think there's a tendency to blame it all on COVID as if we didn't have any problems before.
For sure.
Right.
Yes.
So Dr. Calhoun, let's talk about that, because as you probably see more patients per minute than any of us in the residents, perspective, you're seeing so much on the ground. Not that we're not, but I think that there's just a little bit more of you're just closer to more people. Do you sense that people feel like, oh, the public health emergency is over? I've heard that on the news. There's reason for optimism, or is it more like, oh, they're going to stop caring now, we don't have telehealth? Like, what's the sort of vibe there?
So, I second a lot of what Dr. Gold said, in that, like experts were warning about, an adolescent mental health crisis before COVID. And we were seeing, increased rates of overdoses from substance use. We were seeing increased suicide rates. And then I think COVID just exacerbated what was already there. I see a lot of children in the hospital. So I'm seeing kids who are in crisis, obviously, because they're in the hospital. And we are seeing a decrease in sort of mental health related emergency visits. So we're seeing a decline, which is good. Less kids in the emergency room. That doesn't necessarily mean that kids are doing great, though. It just means that less are coming to the emergency room, which could be a good thing. And it also could be a bad thing, because it means they're not getting mental health help. And we know that most adolescents that have mental illness will never see a child psychiatrist like me. And, specifically my expertise is in the mental health of Black Americans, specifically Black children and adolescents. And so when you talk about adolescent, crisis, there's been a Black youth crisis for over 20 years now, and that is not showing any signs of improvement. And so I have a lot of concerns about the kids that I see in the hospital and kids in general. I have a lot of concerns about the fact that we're still seeing widely televised violence disproportionately towards Black Americans. I have a lot of concerns about my, Asian American patients who are still experiencing, downstream effects of anti-Asian hate, my transgender patient. I mean, there's just a lot going on right now. And I think as physicians, they try to tell us like, oh, be apolitical, but you can't, because kids and adolescents, they want to talk about what's going on in the world right now. And I think they're just waiting for us as doctors to give them permission to talk about the things that they want to talk about. I think we need to talk about it.
I want to,
On
go
that
ahead.
here.
Yes, please. I want to follow up.
Yeah, no, I just wanted to say that like psychiatry, maybe more than all fields in medicine, has no choice but to get into those conversations, right? Because everything that's bringing somebody into their office is what's going on in their lives. And it's very hard. Like, that's housing, that's food, that's access to care, that's, are you not allowing them to get the care they deserve in the state that they live in? Whatever it is, like, it's very, very hard in the fields that we do to pretend that doesn't exist. And that's what's bringing them in as like their trigger, right? Like, so we can't ignore that in our field at all. And if you do, like, frankly, I don't actually think you're doing a very good job. So I agree with Amanda that it's just really challenging to say something like, we can't be political, because some of this stuff shouldn't be political, but on top of it, like, that's what our patients are talking about. And college kids in particular, I mean, if you look at like the Vietnam War as an example. College kids feel things and feel things deeply and always have. And it's a group of activism. It's a group that wants to change the world, but not wait for the world to change, right? And that affects their mental health because every day they wake up and there's more and they didn't change it. And that's really, really hard. And to work in that group and not watch the news, not know what's going on, not be able to talk about it is just impossible, honestly.
Actually, I really want to talk about social media and follow up and the news and follow up with what Dr. Calhoun was saying a moment ago, because I'm really truly on the fence on this. And because on one hand, I think we all know that social media is a way of to people connect. I mean, I literally have met some of my closest friends from Twitter. And like that's not fake, right? I mean, some of it turns out, oh, you meet and you're like, oh, actually, it's more of a Twitter relationship or friendship, or we work on papers together, but we don't have like drinks with our families, whatever. And then other times it's like, oh no, this was a seamless transition. And so there's the opposite of loneliness. It's like an access to the whole world. On the other hand, you're constantly being bombarded with messages. And what I want to ask to follow up on a comment that you made about this has been going on for a long time. I almost feel from my perspective that there was like a downplaying or an erasure of the problem that you're talking about. And now it's out there every day and it's in your feed. And in a way, that's good because we don't want to hide it. But can there be a point where kids looking at this and it seems more overwhelming and scarier in a way that actually, I wouldn't say makes it worse, but just adds a stress?
Yeah, I mean, I think, as with most things, everything in moderation, right? And so when social media becomes your whole world and you can't have a face-to-face conversation with another human, which I have encountered, not just adolescents, adults like that as well, I think it becomes a problem because, you need to be able to have conversations with humans in real life. But I also think that, relying on social media for networking and being able to connect with people about things that are very important can be actually very helpful, especially if you're, an adolescent from a marginalized background and you may be in a situation where no one around you really supports you. And so sometimes online communities can be life-saving, but there's everything and anything out on the internet. And so I think it's important, to have some monitoring, especially for adolescents. And it's kind of a constant battle between, you don't want to cause sort of angst amongst the adolescent where they're sort of over restricted on the social media by their parents or their caretakers. But there needs to be a little bit of monitoring because you don't exactly know what they're doing and what they're being exposed to. And there's some pretty creepy websites out there. And as far as, just the widely televised violence of Black people, I've spoken about this multiple times, and I'm pro recording the violence and the racist violence. We need it for evidence and it's important, but I'm not pro it being so widely televised that I click on a website and suddenly I'm like, the video has started of another Black person being murdered. And, the studies are starting to come out that show that when this happens, meaning a widely televised sort of murder of a Black Americans do suffer mental health wise for a few days after that and possibly longer. I mean, there are new studies. But it actually showed that white Americans did not have side effects, which I think is important to put out there because why? And is white America becoming more desensitized to violence towards Black Americans? Because I will tell you, we as Black Americans are not desensitized to it. It's very hurtful. But the fact that in that study, white Americans had no negative side effects from watching that is concerning to me. And so again, you kind of see, is it really healthy or helpful for either side to continue to see this violence? I mean, can we talk about it? Can we write about it without having it just being in our faces? And so I think to bring it back to adolescents, they are most definitely seeing all of this. And so that's very difficult when you're growing up as a Black child to be seeing that happen to people your age and to think, oh my gosh, could this happen to me? And it could. And being able to have those conversations with adolescents, I think is just really important because they are being exposed to this stuff. And so I think the worst thing to do is sort of, pretending like it isn't a thing. Like, like Jessi said, I don't think you're a good psychiatrist either. If you're like, oh, let's not talk about racism. Let's just talk about your mental health. Huh? Like it is a stressor. It is a trigger. And so you can't about housing if you're, your patient. So I think we have to talk about this, and social media is sort of honestly a good way to open the conversation.
And Jessi, go ahead.
No, I think the thing with social media is a lot of the onus does fall to the companies to have some like control over what's being put out there, because we also have kids who have self-harm who go to social media and they can find more pictures of self-harm, and they use keywords and they know what they can search. We have kids that have eating disorders and learn what not to eat and the best foods to trick doctors from the internet, right? And so a lot of our patients are going to social media for that kind of content. So we need to be able to not have that be content that they can get exposed to. But in the same realm, like, how many hours is too many hours on social media? When do screens start? All of that data is horrible. Like, from you who like really cares about data, Dr. Faust, like, it is not good data. Like, there's some data that says it's really bad for your mental health. There's some data that says it's fine. And it's very hard to say when the screen time age like should change and what we should be advising parents. But I mostly am in a risk benefit conversation with that, which is like, what's your mood like when you're on it? How's your concentration? How's your sleep? Is it affecting your interpersonal relationships in some capacity where like you're not actually talking to real people because of it? But if you're a person who's like has social anxiety, you might never have had those conversations if social didn't allow you to start it. So as much as there's like a developmental risk to learning behaviors and communication through a device, there's also benefits to it if you wouldn't get out otherwise. So I think we have to be really mindful that the data is not great and not mixed or very mixed, because it is very complicated, and people really want to say like teen rates of suicide are higher and self-harm are higher simply because of social media, and that is far too simple. But it is a factor, and I think we have to treat it like a factor, but we can't say, just like there's no way you could say it's the only thing, you know? It's impossible.